I'll just put my camera on for a second just so that you can see who I am. Welcome, everyone. It really is a privilege to be online with so many of you, and I really hope that this workshop is helpful to you, and that certainly you'll have a clearer idea of what is required from you in terms of writing the EISA. So I'm going to turn my camera off now that you've seen me, just to save some bandwidth, and for those of you that may struggle with your connection, please try and keep your microphones on mute, and then as has been indicated, to use the Q&A function. If you do have any questions, you can type them into the Q&A. Right, so as Ms. Mulalo has already said, I am going to go through the format and content of the examination. In particular, I will focus on the calculation questions, and then we will move on to the general questions, and we will give you an opportunity to actually answer 10 calculation questions and 10 general questions during this workshop, to give you an idea of the standard of questions that will be asked in the EISA. So the format of the EISA exam, I hope you all know what EISA stands for. We use this terminology, and maybe some people don't actually know what this stands for. The EISA is External Integrated Summative Assessment. And so if you hear us talking about the EISA, that is what we mean, and it is specifically, the terminology is used specifically for the basic and the post-basic qualifications. So the exam itself is an online examination, and it is an open book exam. Now, because it's an open book exam, people think they don't have to study, but that is not true. Okay, so it is an open book exam. In other words, you can check your answers if you're unsure of something, but you should, as far as possible, be prepared for the exam as though you were writing a normal closed book exam. And then you only reference your books if you have to double check yourself on something. Okay, so that's the first warning. Then secondly, the exam itself is 100 multiple choice questions. A multiple choice question means that there's a question followed by 4 options, and you have to select the single best fit. So the single best answer of the 4 answers that you are provided with. The exam itself is a 3.5-hour exam, and you are required to achieve a 50% pass mark. We do not use negative marking in this exam, so you should, as far as possible, answer all of the questions. You won't be penalized if you answer a question incorrectly, except that you don't achieve the mark for the question, but you won't get like a -1 for the question. Okay. The exam is further divided into 2 sections. There is a calculation section and a general section. The calculation section is 16% of the paper, which equates to 16 questions, and the general section is 84 questions, and you have to pass each of those sections independently. So for those 16 multiple choice questions, you must get 50%, and for the 84 multiple choice questions in the general questions, you must also get 50%. So you can't fail the calculation section and do well in the general section. You will still then fail the exam. You must get at least 8 out of the 16 questions in the calculation section correct. Okay, so when we set the exam papers, we set the exams according to the exit level outcomes of the qualification. So the qualification has been published, and there are 4 exit level outcomes, and the exam is divided into various questions for each of those exit level outcomes. And because we are examining what we refer to as a generalist, questions in the exam will apply to community pharmacy, to institutional pharmacy, to manufacturing pharmacy, as well as wholesale pharmacy. So if you did the old program, perhaps you you studied only in community pharmacy, and so that is what you're used to being examined on. Or if you did your original training through manufacturing, you may only be used to being asked manufacturing questions. But this exam is a generalist exam, so it's testing to see whether you can practice in any of the 4 sectors that I've mentioned. So I mentioned there were 4 exit level outcomes. These are the exit level outcomes. The first one is applied basic scientific knowledge to provide technical support in delivering pharmaceutical services. And that actually forms the bulk of the exam paper. Then the second exit level outcome is to provide technical support for receiving, storing, picking, packing, and distributing stock, to perform stock counts and participate in stock taking in compliance with all the various standards, GMP, GWDP, and GPP. And then ELO 3 has a broader focus in terms of manufacturing. So the technical support for manufacture, packaging, repackaging, specifically within the scope of a basic assistant, so non-sterile medicines and scheduled substances in compliance with good manufacturing practice guidelines and under the supervision of a pharmacist. And then the final ELO is providing technical support for compounding, manipulation, and preparation, again within the basic pharmacist assistant scope of practice as non-sterile medicines, and in compliance with standards as prescribed in the Good Pharmacy Practice Rules and Good Manufacturing Practice Guidelines, it also under supervision of a pharmacist. So if we look at the exam breakdown in a little bit more detail, we said that there are 16 calculation questions and 84 general questions. But if we look at the breakdown in terms of the exit level outcomes, you will see that the bulk of the exam is that exit level outcome 1, which is the foundational scientific principles. We're going to look at a little bit more detail as to what content might be covered in each of those exit level outcomes. And then ELO 2 is about 25%. That was around stock. And then 15% was more manufacturing, and then 20% is kind of practice in community or within a pharmacy environment where you may be doing some extemporaneous compounding and assisting with a few other activities within your scope of practice as a basic assistant. Okay, so here's ELO 1. We said it was 40%. Let's look at what you should be able to do if you are competent within this exit level outcome. So you need to be able to apply legislation related to the relevant scope of practice in pharmaceutical services in the South African context. That means that you're writing the basic EISA, which means that you need to be aware of the scope of practice of a pharmacist assistant in the basic category, and also other legislation that might be applicable to you being able to perform within your scope of practice as a basic assistant. The second competency that you should be able to do is to demonstrate ethical and professional conduct related to your relevant scope of practice. Now, if you look at the documentation, if you look at on the Pharmacy Council website, you will see that there is a code of conduct for pharmaceutical personnel. And so you need to be aware of what that code of conduct is and be able to apply it to a scenario maybe that you might find yourself in, where you have to make a decision about your ethical conduct and your professional conduct in a pharmacy. The third competency is that you need to be able to apply basic pharmaceutical terms and concepts concerning non-drug delivery, non-sterile drug delivery systems and their routes of administration. So things like, what are non-sterile dosage forms? What are their routes of administration? Is it an oral? Is it a Is it a transdermal? Is it a topical? Different types of dosage forms. Is it a tablet? Is it a capsule? Okay, and definitions around that, understanding that, how they're used, when they are used. And then the final competency is to be able to apply basic scientific principles and perform basic scientific calculations. And hopefully when we do the calculation questions, you will have an idea of what the requirement is for a basic level pharmacist assistant. Most of it is around being able to convert, and we'll go through a couple of slides just reminding you about how to do conversions. But maybe it's got to do with calculating a number, particularly when it comes to stock. There might be more of an applied question in terms of, how many items might you need to order, that kind of thing. So, right, then the next ELO is about 25% of the paper. And this one does revolve largely around stock and stock management. So again, linked to your scope of practice. So it's very important to know your scope of practice so that you understand the limitations of what you need to be able to do as a basic assistant, and that will then guide how you have to study for this exam. So the first part of this one is to conduct distribution and control of stock of medicines and scheduled substances according to standard operating procedures and according to the various standards that we have. Pick, pack, and secure orders for medicines or scheduled substances according to requirements, and check that orders are dispatched according to standard operating procedures. Complete documentation and maintain records following applicable legislation and standard operating procedures, and then participate in stock counts. So you can see how there may be a calculation around stock counts in the exam. Right, then the third exit level outcome is the manufacturing, or the main focus would be around manufacturing. And this is to be able to apply your pharmaceutical and good manufacturing principles and legislative requirements in the manufacturing, packaging, or repackaging of non-sterile medicines, organizing and preparing resources, materials, and equipment for the preparation of specific medicines following relevant standard operating procedures and documentation. You need to be able to know how to handle the materials in different environmental and storage conditions that might be required for different active pharmaceutical ingredients and the security requirements around those. You need to be able to know your scope in terms of participating in manufacturing processes for non-sterile medicines, packing and repackaging of medicines and following good manufacturing principles, ethical principles and relevant legislation, knowing process documentation and standard operating procedures linked to packaging and repackaging, and then be able to complete documents and maintain records following good manufacturing guidelines, again, within your scope of practice as a basic assistant. And then finally, we look at principles of good pharmacy practice concerning the compounding of non-sterile medicines and substances. So the compounding, if you are working in maybe a community or a hospital pharmacy or even in a compounding pharmacy, what are the requirements for the smaller scale extemporaneous compounding of products? You need to be able to know how to compound a simple solution, suspension, and a semi-solid or an emulsion following formulas or instructions using relevant standard operating procedures and process documentation, and applying the principles of good manufacturing practice and good pharmacy practice for specific patients. So you aren't required to do that in your exam, obviously, but you need to know the principles and you need to know the process from a knowledge and a skills base, so that if you're given a scenario, you're able to identify the process and maybe identify something that's maybe missing in the process, or you may be asked something along the lines of, again, a calculation, how much, or do a conversion, anything that might relate to compounding of a solution or a suspension or an emulsion. You need to then be able to complete records for each preparation, following legal requirements and organizational policies and procedures, check and clean equipment according to standard operating procedures, perform any housekeeping activities, and operate a personal computer to generate documents and spreadsheets. Okay, so if we talk about operate a personal computer and generating documents and spreadsheets, we really are referring to being able to or know what a Word document is, a word processing document, understanding what a spreadsheet is and what the capabilities of a spreadsheet are. Right, so I just want to emphasize again, I kept saying within your scope of practice. So, you know, anybody in a pharmacy will be told that they need to be able to complete records for a preparation. However, you need to then re-look at your scope of practice and make sure that those records that you are completing or need to know how to complete still fall within your scope of practice. Okay, we're not asking you to learn what a pharmacist's role is or what a post-basics role is. It's still the role of a basic pharmacist assistant that you need to focus on within each of these ELOs. So in the exam, we ask different levels of questions. And the first level of question is a very simple knowledge or comprehension question. So an example of a knowledge question is where we would ask you a definition. We might say, which of the following definitions best describes pharmaceutical manufacturing? And then you'll get 4 definitions, and remember, you're choosing the single best answer. The second level of question that you might be asked is an application question. And so that's just the same information. So you've learned a lot of knowledge. Are you able to use that knowledge in a similar but new situation? And so you may get asked a question that says, in a certain environment, are you able to do this? And then it's applied to a particular scenario. And then there's a few higher order thinking questions where you are given some information and you've got to maybe problem solve or think through the information that you've been given to then assess what is the single best answer in this situation. Right, so then you've got to be able to prepare for your exam. Please make sure that you know when the exam is. I think the office certainly will be communicating with you exactly what date and time the exam is. Make sure that you diarize that. Also, where the exam is, and I think most of the exams are now written online. And so for you, you need to make sure that you've got a venue or a space where you can write the exam that is quiet. Someone's moving my slides. Where it is quiet, that you're not going to be disturbed. It can't be in a shared space with other people around that might be able to assist you. You need to plan that space ahead of time. Don't decide on the morning that you're going to sit in the stock room and write your exam. Okay, so make sure that you have created a space for yourself, set up a space for yourself that is conducive to writing an exam. Okay. What resources do you need? And again, the office will explain just now, a little bit later on in this meeting, what resources you need to have available to be able to write the exam. Right, we're trying to address with you how you can prepare. Today we will also give you some references that you can use to prepare and how to use the references. The office will also tell you what references are available on the exam platform that you may be able to access during your exam. But again, I just want to re-emphasize that although this is an open book exam, you still need to prepare for the exam. Okay, you need to understand how to do your calculations. You need to have the knowledge for each of those exit level outcomes going into the exam, and you only go to your book if you want to confirm something. Okay, right, and then for your actual exam, you need to know what to bring or what to have with you. Obviously, how the online exam works, and there is a practice exam that is compulsory that you will have to do. And that certainly will help you understand the whole online setup and how it works, because it might be a little bit intimidating the first time you do it. And then how long the exam is. So we've already told you that this particular exam is 3.5 hours long. Make sure that you are 30 minutes ahead of time and that you give yourself some time afterwards as well. So you're going to need at least 4.5 hours for this exam or to write this exam. And so make sure that if you're working, that you book leave, that if you're writing at home and you live in a home with lots of people, that they know that you are occupied for the next 4.5 hours and that they shouldn't disturb you. Okay, so we're going to look at the calculation questions now and how the calculation questions are broken up. Okay, so you will see from this diagram that only 3 of the exit level outcomes actually have calculation questions associated with them. Okay, so the first ELO, there are 31% of the calculation questions come from that ELO. That is the basic scientific principles ELO. Then ELO 2 was the stock management ELO, and that one has got about 19%. And then the last ELO was the compounding ELO, and that one has 50% of the questions, of the calculation questions, come from that ELO. We look at it in a little bit more detail. The types of questions you might get asked in the ELO 1, which is basic scientific principles. We might ask you some basic conversions. So how many milligrams is in a gram, for example, and you'd be surprised how many people get that wrong. So that's a good one to go practice. How many milliliters in a liter? How many milliliters in a or how many milliliters is a medicine measure? It's not even a calculation. Do you know how many milliliters is in a medicine measure? You'd be surprised how many people don't know that. Okay. Stock management in ELO 2, we're going to look at stock consumption, how much stock has been used. We're going to look at reconciliation calculations. So how much stock was received, how much is expired, or how much was damaged, and so how much have I got that's usable stock. And then also maybe you get asked questions around the value of stock. You've received a certain amount of stock at a certain price. What is the value of the stock? And then finally, your ELO 4 is your compounding, manipulation, and preparation, also known as extemporaneous compounding, where you may need to calculate quantities of ingredients according to a formula, and also reconciliation calculations in your repackaging operations. So if you manufactured 10 items, but you got 15 labels from the dispensary, and how many labels are left over. And so that's an example of a reconciliation calculation. How many labels do you have to return to the pharmacist after you've repackaged your 10 packs? For the pharmaceutical calculations, we have a few textbooks that we recommend that you use as a resource to prepare. They are not essential, but these are recommendations. You also don't have to look at all three. If you can at least get hold of one of those, that would be a good start. So I think that these calculation or these references are available on the Pharmacy Council website. If you don't write down the references now, you can access them on this presentation on the Pharmacy Council website. Again, here's another reminder: textbooks are of more value before the exam than during the exam. If you spend so much time looking up an answer in the textbook, you're going to run out of time towards the end of your exam. And so that's why, again, just emphasizing that an open book exam doesn't make it easier. In fact, sometimes it makes it more difficult because people spend too much, they don't prepare enough, and then they spend too much time trying to look up the information. Right, so some tips for your calculation questions. It's important to learn the principle. You can't memorize calculations. Those of you that enjoy calculations will know that practice makes it easier when you then get a question that's not the same as something that you've been practicing. So the more you practice a principle, when you are faced in an exam with an applied question that you haven't seen before, you will be able to maybe recognize the principle and be able to do the calculation. Okay, so please, when you prepare for your calculations, learn the principles. Don't try and memorize calculations, examples that are in the textbook or in your notes. And then the second thing that we want to just remind you of is that we have SI units, and this you will see a couple of times in your exam. You'll see a percentage and then W over V. And understanding what that W over V means. Okay, so a percentage always refers to out of 100. You can't get, if someone says you got 150%, well, you can't get 150% for a test. You can get 100% or lower, but you can't get 150%. So where you see, unless you got asked a bonus question, but let's not confuse the issue. So we're going with 100%. If you see a percent, then you know that you're dealing with 100 milliliters. Okay. And if it's a W over V, we're referring to a weight and we're referring to a volume. And so it's 1 gram. If this is 1% weight per volume, it's 1 gram in 100 milliliters. That is the understanding of percentage W over V. If it's V over V, volume per volume, what does that mean? If it is weight over weight, what does that mean? So it's important to go and revise your units and understand what these symbols are and what they mean. Equipment, you are allowed to have a scientific calculator, although for the basic exam you probably don't need a scientific calculator. You can probably just use a basic calculator, but you won't be able to have your phone in the exam, and on your computer you can't open another screen because it will notify the invigilator that you are accessing another screen or that you're moving around and using a second device. So you can have a basic calculator. You can use a scientific calculator, but if you don't have one, you can use a basic calculator for the basic EISA. And then a tip, again, is to use the same one in your exam that you use when you were practicing, so that you know how it works and you're not struggling to use a calculator that is borrowed from someone else and it's new to you, and you're wasting time and getting yourself anxious during the exam because you don't know how the calculator works. Okay, and if it is a battery operated calculator, make sure that you've checked the batteries and that you know the settings of the calculator. And then we've said it's an online exam, but it's always important to have a paper and pen next to you in case you want to make notes or you want to do the calculation. Remember, on the exam platform, you're only going to click on the correct answer. But to work out the calculation, you're going to need paper and pen with you. Right, so now the next slide, you're going to think, why are they doing this with us? But this is one of the things we find causes the most mistakes in an exam. So we're showing you the conversion here of weight, and you really do need to practice this and get it into your minds where you're not having to always refer. Okay, so we deal largely with grams and milligrams. Okay, so if I have 1 milligram, how many grams do I have? And to work out how many milligrams, when I'm converting 1 milligram to a gram, I need to divide by 1,000. So 1 milligram is equal to 0,001 grams. Milligrams, 1 milligrams goes to a decimal for grams. However, if I have 1 gram and I need to convert to milligrams, 1 gram to milligrams, I must multiply. So 1 gram times 1,000, then I'm going to have 1,000 milligrams. Okay, and similarly, when you're going from grams to kilograms, or from micrograms to milligrams, you're going to divide by 1,000, and if you go from milligrams to micrograms, you're going to multiply by 1,000. And the similar principle applies for liquids. We use a lot of milliliters and liters. So how many milliliters in a liter? We're going to divide how many liters or convert a liter to milliliters, then we're going to multiply. So when we go from the larger unit to the smaller unit, you multiply. And if you go from the small unit to the large unit, you divide. That acts as a reminder to you. And if you really struggle with it, then you need to have a reference point that you can quickly look at to make sure you go in the right direction when you are doing your conversion calculations. Remember to select the correct formula. We spoke earlier about learning the principle. So if you have learned the principle, then you're able to select the correct formula for doing your calculation. When you are working on a piece of paper next to you, you've got your paper and pen and you're doing your working out on your paper and pen, make sure, double check yourself that you have written down the correct digits. Okay, so you looked on the computer, you saw what the calculation is, you saw the numbers, and then you write it down on your piece of paper, and instead of a 3, you write down a 5. That's going to cause your answer to be incorrect. So when you've written it down, double check the screen, re-look at your number on the page and make sure that they are the same. Okay, otherwise that's another area where people often make a mistake, is they transcribe the wrong number from what they read onto the page that they're going to do their calculation on. Okay, so make sure your figures are correct. It's quite a skill to be able to read a question and make an estimate in your mind. I think that the answer is going to be around 20. And then you do your calculation on your paper and you come up with an answer of 2,000. That should be a red flag to you and say, hang on a second, when I looked at the question, I thought the answer was going to be about 20, but now I'm doing the calculation and now my answer is 2,000. What am I doing wrong? Okay, so try and when you're reading the question, think about an estimate, what you think the answer could possibly be. And then when you calculate it, if you have done your calculation right, it should be more or less the estimate. Again, it's a skill that you need to learn, and you can only learn that if you practice. And then double check your calculation. So redo your calculation, and don't try and redo the calculation you've already done. Close your page, open a new page, start again, redo your calculation, and then double check, are your two calculations the same? Right, and then it's very important to manage your time. Sometimes people find the calculation questions are a little bit more challenging, and so they might need more time on the calculation questions, but then you might end up spending too much time on the calculation questions, and then you run out of time on your general questions. So you need to manage your time. There's approximately 42 minutes in the exam that is available for you to complete your 16 multiple choice questions. That gives you almost 3 minutes per question, just less than 3 minutes per question. So, you know, especially a conversion question, if you know how to do conversions. Can I just ask the participant to turn off their mic? Can you mute your microphone, please? Right. So maximize your time. You've got 42 minutes. Use all of your time, but also just be aware that you don't go over your time. Okay? We don't do negative marking, so don't leave anything blank. Okay. Right. So the next part of our workshop is I'm going to go to the next screen, which has got a link on it, or it's got a QR code. Now you can either type the link into your browser, so you need to have internet access, you need to have data or Wi-Fi, and you can, I'm going to put this link, I'm going to ask the office just to paste this link into the chat box. So you can either copy the link into your browser, or if you've got a phone that has scanning capability of a QR code, you can just scan this QR code and it will take you to a little quiz. It's only a 10-mark quiz, and you've got about 10 minutes to go through the questions, and then we'll do some feedback on those questions, and hopefully that will give you a better idea of the level of calculation question you may be asked in this basic exam. So I'm going to mute for now, and just give you an opportunity to scan the QR code, or if the office has already, maybe they've already copied it into the chat box for you. Okay, I'm going to do it quickly. Refilwe or Taniko, who is on the call, that can copy the link into the chat box, please.
Dr. Fogarty,
Yes.
We will do it.
Thank you.
Okay. It is done.
Okay, I can see that people have started accessing the quiz, so the link is working.
And Dr. Fogarty, it is also on the chat function. Thank you.
Thank you. Okay, if you're wondering why we're quiet, it's because you should be writing this, or you should have access to this calculation quiz. The link apparently is in the chat box. I'll put it up on the screen again. So there've been about 150 responses so far. There's about 3 minutes left. And then we will do a quick review of the answers. Okay, so we're just going to go through the questions now and review them. You will see people are still submitting answers. And so the screen's going to keep flashing on and off like that. But we can see the first question was a conversion question, a straightforward conversion question, convert 5 grams to milligrams. And only 65% of people are getting that right. Let me take you back to this presentation. Okay. So if we look at the presentation, whoops, and we said, if we're going from milligrams to grams, we're going to divide. Okay, so but the question is saying, I've got 5 grams, how many milligrams is that? Do you agree with me? The question is saying, convert 5 grams to milligrams. So then I must take 5 and I must times it by 1,000, which is going to give me 5,000 milligrams. Only 65% of people have said that. Do you understand why it's so important to be able to do a conversion? That's a simple conversion. But what happens when you're working in a more complicated calculation and you first have to do a conversion to then be able to do your calculation? If you're already getting it wrong at the time of converting, then your answer is going to be wrong as well. You need to focus on these conversions and make sure you understand when you're going from the lower value to the higher value, from milligrams to grams, you're going to divide by 1,000. And if you go from grams to milligrams, you're going to multiply by 1,000. Right, so next question. How many medicine measures is 30 mils of cough syrup? Now, if you remember earlier in the presentation, I said you would be surprised how many people don't know how many milliliters are in a medicine measure. So for this question, you first got to start off with how many milliliters are in one medicine measure? And the answer there is 5. And now I've got to work out how many of those 5 mils medicine measures is 30 mils of cough syrup. So the way to do that calculation is to say 30 divided by the 5 mils, and your answer should be 6. Okay, so those that got that one wrong need to re-evaluate what they understand by the question. Did they not understand how many medicine measures, how many milliliters are in medicine measures? Did you think it's only 1 milliliter? Which is maybe why some people answered 30. I'm not sure where the 3 and the 2 come from or how you did that calculation, but you need to read the question, think about it, and work out where you went wrong so you know where to correct yourself. Right, the next one. What does 25 m over v mean? So mass per volume or weight per volume, W per V, what does that mean? And if you remember, we said it's always links to 100. So that's already all in the answers. So all of the answers do say 100. If you had seen one that was maybe 1,000 or one that said 10 mils, that would be an obviously wrong answer. Okay, because the percentage refers to 100 mils. But the 25 will always refer to grams. Okay, so it's a percentage, grams per milliliter. And so this particular answer is 25 grams per 100 mils. This is now working out a percentage. And so it's asking you to work out what 50% of 16 is. This is the kind of question you might find under ELO 1, and ELO 1 is your basic scientific principles. And so working out what is 50% of 16, you can do it in different ways. If you know that 50% is half of 100, then you know that you're looking for what is half of 16. And so the answer in this case is 8. But there are other ways to do this calculation as well. Okay, this next one is a little bit more complicated. A person weighed 70 kilograms at his previous doctor's visit. At his current visit, the patient lost 5% of his weight. How many kilograms has the patient lost? This is a similar question to the question before. This is what we would call, question number 4 is what we would call a knowledge question, a straightforward question. Just calculating a percentage of a number. What we've done in question 5 is we've made it an applied question. So we are asking what is 5%? He's lost 5% of his weight. So we're asking what is 5% of 70? But it just takes it up a level to application. So now you have got an example of the 2 different types of questions you might get asked. A LOC 1, or just a knowledge question, versus an LOC 2, which would be an application question. And so 5% of 70 is 3.5 kilograms. Okay, question 6 is an interesting one for me because every time I ask this question in an EISA, the majority of students get it incorrect. So then I posed this question to many academics, to several colleagues, and asked them for the calculation. And so I have checked and double-checked that this answer is correct. I've then highlighted the word total solution to help you with this, and yet still only 22% of the respondents are getting this question correct. So the question is a ratio question. It says if 20 milliliters of alcohol are added to 40 milliliters of water, what is the ratio of alcohol to the total solution? Those of you that have answered 1:2, you're telling me what the ratio of alcohol to water is. Yes, the ratio of alcohol to water is 1:2. Okay, how do I work that out? 20 over 40, I'm going to get 1/2, which is the same as 1:2. But the question isn't asking what is the ratio of alcohol to water. The question is asking what is the ratio of alcohol to the total solution. Now, you first have to add 20 plus 40 to get your total solution. That gives you your 60 moles. That my total solution, when I add the 2 together, is 60 moles. So now what is my ratio of alcohol to the total solution? Now I say 20 divided by 60, which is 1/3. Or we write it as 1:3. I hope that one makes sense. Maybe this is more of a problem-solving question, maybe a slightly higher order thinking question, because you have to do 2 steps to get to your answer. Right, so now here is more of maybe a stock question or a reconciliation question. During the packaging of a batch of medicine, 1,980 labels are used from 2,000 that were originally issued. What percentage of labels must be returned to the dispensary? Again, a higher order thinking question because there's more than one step. So first you've got to work out 1,980 labels were used from 2,000 that were originally issued. So the difference between the two is 20. You've got 20 labels left over. Now, I'm not asking how many labels must you take back to the dispensary. I'm asking what percentage of labels is returned to the dispensary. So yes, 20 labels is what's left over and must be returned. But what is the percentage of that 20 of the original amount that was originally dispensed? So 20%, 20, you're working out the percentage. What is 20% of 2,000? And the calculation then, you should get 1%. Right, 50 containers of medicine are counted during a cycle count of 50 containers. 5 are expired, 2 are short dated, and 3 are damaged. How many containers of medicine can still be issued? Okay, so this one, you need to know some knowledge, and then you need to apply that knowledge. So let's start here with expired. Can you use expired stock? No, you can't ever use expired stock. Can you use short-dated stock? Yes, you can use short-dated stock up until the end of the month in which it is short-dated. You don't want to be issuing it, but beyond that, but you can use it up to the expiry date. 3 that are damaged. Can you use damaged stock? No, not likely. So if you can still use your short-dated stock, then you don't need to subtract the 2. So of the 50 containers, 5 are expired, 2 are short-dated, and 3 are damaged. How many containers can still be issued? So you only need to remove the 5 and the 3. So that's 8 containers that you can't use, and therefore the answer is 42. For those of you that answered 40, you go back to your question. Can you use short-dated stock? Can you still issue short-dated stock? Okay, go back to your knowledge module. Check, can I still issue short-dated stock? Now we've used that in an applied manner here, where you've got to think about it. Okay. What is the total value of 15 containers of medicine that has a cost per unit of 130? So in this case, it's saying a cost per unit, and they've only given you 15 containers. And so per container, each container costs 130 Rand. So it's just a multiplication, 130 times 15. And then the final question is, how many tubes of a 20-gram cream are required to be added to 80 grams of aqueous cream to make a 20% mass per mass compounded cream? Okay, so the 20 plus the 80 tells you that you're going to end up with 100 grams of cream. We're also working with a 20% mass per mass, and we know that that means 20 grams in 100 grams, right? 20 grams in 100 grams. So to make up my compounded cream, then I only need 1 tube, because that is 20 grams of cream, of a tube of cream in my 100 grams. And 20% also means 20 grams in 100 grams. And therefore, I only need 1 tube to make up my 100 grams of compounded cream. Okay, so you need to rate yourself on how you did. And now maybe you have a better idea of how much preparation you need to do towards this exam. I think that I'm at the end of my session.
So it's 13:50, 44 seconds. We are going to ask that we answer the questions that were not addressed that relate to the calculations of the questions that were on the screen that you worked out on. So we have Dr. Terrelyn Fogarty to address those. We will hand over to Elizabeth to read the questions, and then Dr. Fokati will be able to address those. Thank you. Dr. Fogarty, there was a request to clarify a few of the calculation questions. So it was 4 questions in total. The request included reworking, for clarity's sake, question 3, question 7, question 9, and question 10. So there was a request for us to please go through those 4 questions again.
Okay, let me just share the screen so that we can all see what we are working with.
Thank you very much.
Okay, what does 25% mass per volume mean? This is a theory question, a knowledge question. It's something you would find in a calculation textbook. The 25% always refers to your volume, which will be 100. And when it's volume, it's 100 mils. And when we talk about mass, it's always grams. And so for this one, 25% means grams per mils. In this case, 25 grams in 100 mils. It's not really a calculation. It's actually more of a theory question, more of a knowledge question, an LOC 1. Okay, question 7. During the packaging of a batch of medicine, 1,980 labels are used from 2,000 that were originally issued. This is a reconciliation question. So the question is asking how many labels you need to return to the dispensary that issued the labels. In a manufacturing facility, we talk about a dispensary issuing labels and containers and boxes and cartons and that kind of thing. So what percentage of labels must be returned to the dispensary? So if you've used 1,980 labels, you haven't been told that there were any that were damaged, you haven't been told that there were any that needed to be destroyed, there were 20 remaining then. Okay, so you just need to say 2,000 and subtract 1,980, and then you're left with 20, and then you need to work out what is the percentage of 20 labels of 2,000, and the answer then is 1%. And this is just a cost, 15 times 130, to give you the total amount. So there's no trick or analysis here. And then this last one, this one you basically need to understand again what percentage mass per mass means. So 20% mass per mass means 20 grams in 100 grams because you're working with weight. Okay, so 20%, if you know what 20% means, it means 20 grams in 100 grams. And if we look at our question, it says how many tubes of a 20-gram cream are required to be added to 80 grams of aqueous cream to make a 20% mass per mass compounded cream. So once my cream is finished being compounded, it must have a percentage mass per mass of 20%, which means 20 grams of active in 100 grams of the compounded cream. So we have to assume, because all the information you've been given is 20-gram cream. So this 20-gram cream, you have to assume is the full active ingredient. So the 20-gram tube is the full active ingredient in your aqueous cream. And so the total volume of this compounded cream that you're going to make up is 100 grams. So 20% of the total weight of the compounded cream is 20 grams, and your tube is 20 grams. Therefore, you only need one tube to make up your 20% compounded product. I hope that makes more sense. 20 grams is 20% of 100 grams. And so the link here is that you have to understand the mass per mass is grams per grams. 20 grams in 100 grams. And if you consider that your cream is the full active ingredient that's been added, then you've got 20 grams with your 80 grams of aqueous cream, giving you that full 100 grams of compounded product, and therefore
over to you.
Thank you, Chair. Good afternoon, everyone. I would like also to thank Dr. Fogarty for taking us through. I'm going to carry on with from the general questions section. So one important thing to remember is with your general questions, there are 84 questions that you have to answer. And the bulk of those questions will be coming from exit level outcome 1, which makes up 42% of the questions. And exit outcome 1, just to recap briefly, that's the one where you're talking about basic scientific principles, where you're applying your basic scientific knowledge to provide technical support in delivering pharmaceutical services. Okay, so, and then the other one, your exit outcome level 2, that's the one that pertains to mostly stock management. And stock management, you manage your stock whether you are in retail or wholesale or even within a manufacturing facility. And all of this is done within the provisions of your current good manufacturing practice, your warehouse and distribution practice, and good pharmacy practice. So it's important to note that the distribution of your general questions, it covers your different sectors where you are going to be practicing in as a basic assistant. So it will cover your pharmaceutical industry, it will cover the institutional pharmacies, your hospitals, clinics, and it will cover also if you are working in wholesale or distribution. Okay, we can go on to the next slide. Okay, right. Some here, I'm going to just briefly point out the reference materials that you can use as you prepare for your exam, and reference materials that you can bring with into the as you write the exam. So you are permitted to use your Martindale, your SAMP, your MIMS, and your standard treatment guidelines that you would get from the Department of Health website. So you can have physical copies of books like your Martindale, your SAMP, your MIMS, and then you also get online references, like your EM guidance or EML guide. Okay. Can you just move to the next slide? All right. So of all the reference materials that you're using, please just try to make sure that you are using reference material that's relevant to the South African context. So stick with the recommended references. So you've got also some of these online applications where you are able to download your EML and STG guidelines. You can also get your good pharmacy practice guide online. And with SAPRA, if you go onto their website, you'll be able to find the good manufacturing practice guide. And also please note that SAPRA has adopted the PICS basic good manufacturing practice guide. They also provide a link to those which you'll be able to download. All right. Okay, moving on. So if you go onto the pharmacy website and you click on the link that looks like a book. It takes you to the publications tab where you get your legislation, link to your legislation guides and the pharmacia. So if you follow that link, you see a list of regulations, rules, and board notices. So remember, the exam is set based on recent publications, recent regulations. So it's important that when you are referring to legislation, you refer to current legislation. So any changes in the scope of practice, whether it's of a basic assistant or qualified post-basic, the legislations, you find them within the links listed below. Okay, you can go on. All right, so as I explained, under the regulations, you'll be able to find any of the amendments. And then you also get your rules, your board notices, where you can find any new relevant information. Okay, so how do you use the reference material? So it is important that before the actual exam, you have familiarized yourself with the reference material that you're going to be used. So if it's going to be the Martindale, you have made sure that you understand what sort of information you are able to find within the text and how you locate the relevant information. So in order for you to maximize on the allocated time during an exam, please try and refer to the books and try to familiarize yourself with the text before the actual exam itself. And then if you're looking at online material, please download those references before the actual exam so that you have them saved on your laptop, readily accessible. Right. Okay, some of the helpful tips. You will note in the practice questions that we are going to go through for the general section that as you read the question, maybe they are bolded words or capitalized words like most appropriate, true, is, correct. It's some of those statements, they are trying to bring your attention to specific text within the question. So it's important that you read, you identify those and try and understand. So please read the question carefully, identify the statements which you're sure of, confirm using your the recommended references, the statements that you're unsure of, and you can always carry on if you can't complete the question, and when you have time towards the end of the exam, you can come back to it. Okay. All right. So as I mentioned earlier, remember with your general section, you have 84 questions and you have an allocated time of 168 minutes. So, and each multiple choice question has got 4 options. So approximately you have 2 minutes per question. And also there's no negative marking and you shouldn't leave any blank spaces. And so it's also important to remember that with the general section, the minimum pass mark for that is 50%, right? And Dr. Fogarty, once again, will take us through examples of general questions.
Hi, everyone. So again, you can see that there is a link for you to go to. We'll put that again into the chat, please, if the office can do that for us. And then or you can scan the QR code, and that will take you to 10 questions that would be considered general examples. And then we'll give you maybe only 5 minutes, because it really is it is quite quick, and then we'll quickly go through the answers. So if you can scan that so long, and follow the link to complete that quiz. Thank you. So the first question is what we would also refer to as an LOC 1 question, which is a basic knowledge and understanding question. And really it is a definition. What is the most correct term to use for stock that is at the end of its product life cycle and has not seen any sales or usage for a set period of time? And this one, if you look at the terms that are available, we're looking for the most correct term. And as far as pharmaceutical definitions are concerned, many of you have said expired stock, which the definition is true of expired stock, except that it hasn't said that it has passed its shelf life date. It refers to just its product life cycle and hasn't seen sales or being used for a period of time. And we don't see it often, but as far as the definition is concerned, it is the definition for obsolete stock. The second question, which of the following sectors is the first point of entry for patients seeking healthcare services in the public sector? And so this again is a knowledge question. And if you look at the notes around public sector and ideal clinic realization and Operation Pakisa and how service delivery needs to happen, the first point of entry needs to be at a clinic level. And so the correct answer here is primary healthcare. You know, sometimes things happen in practice that should not be happening. And so you can't answer your questions about what your experience has been in practice. You've got to look at the question from best practice, which is the knowledge base. And the knowledge base says that the first point of entry should be through a primary healthcare facility. So that is why primary healthcare is the correct answer here. Which of the following medicines can a pharmacist assistant basic assist in the manufacturing of? This question is an applied question because it's considering your scope of practice, and then it's not giving you a schedule, it's actually giving you a product. It's giving you suppositories, eye drops, subcutaneous injections, and total parenteral nutrition. And so you've got to be able to work out what exactly are they asking me here. They're asking me about a pharmacist assistant basic and assisting in manufacturing. What am I allowed to do as a basic assistant in manufacturing? Well, I know which schedules I can handle. I know that I can only do non-sterile medicine. Oh, wait a minute. Let me quickly look at these examples. Maybe I need to look at whether this is a sterile medicine or a non-sterile medicine, because you can't tell the schedules from here. So we're not asking you what the schedules are. We're asking if you know which dosage form you are allowed to manufacture within your scope of practice as a basic assistant. And so if you look at these examples, you need to know, your knowledge base is that eye drops are sterile, subcutaneous injections are sterile, and total parenteral nutrition is sterile. And therefore, those three are not within the scope of a basic assistant. The only one that is in with this is non-sterile, and within the scope of an assistant is a suppository. Number 4, which of the following tasks can a pharmacist assistant basic do in a community pharmacy? Again, this is a scope of practice question. Okay, I do want to caution you that if you studied on the what we refer to as the old program, the scope of practice was published last year, the updated scope of practice. So the exam considers the updated scope of practice. So if you did your course more than a year ago, you need to go and update your knowledge about the scope of practice. And so I just want to point that out to you. It is available on the Pharmacy Council website, and you need to go and review that in preparation from your exam and understand what some of the changes might have been that may affect you. Okay, so if we look at what we have here, we've got update the Schedule 6 register. Well, no, that's not within the scope of a basic assistant. Counsel a patient on how to take their medicine. That is also not within the scope of a basic assistant. Again, this might be happening in practice. That doesn't mean that it is correct. You've got to go and look at what best practice is, and that is what is within your scope of practice and within the requirements and within the publications that are available on Pharmacy Council's website. If you are counselling patients on how to take their medicine and you're a basic assistant, then you're currently working outside of your scope of practice. And then performing a blood glucose screening test, that is not within the scope of practice of a basic or a post-basic assistant. And so, again, those of you that are performing any kind of technical skill when it comes to a measurement, you have not been trained to do that, and therefore you should not be performing those measurements. And so, therefore, the only task in this list that a basic assistant can perform is capturing stock onto the inventory system. Okay, number 5, what is a tablet that must first be dissolved in water before swallowing, known as? I would also think that this is a knowledge question, or I'd classify this as a knowledge question because it is about dosage forms and understanding the definition of the various dosage forms. So what is a buccal tablet? What is a modified release tablet? What is a sublingual tablet? What is an effervescent tablet by definition? And if you look at what's in the question, which one must first be dissolved in water before swallowing? The only correct answer there is an effervescent tablet. A buccal tablet gets put into the cheek. Modified release, you still swallow it orally. Sublingual goes under the tongue. The effervescent is the only one that is first dissolved in water before swallowing. Number 6, where is the site of administration for a dosage form that uses transdermal delivery? Transdermal is the term that you need to understand. Dermal speaks to skin, trans across the skin barrier, and therefore the correct answer is the skin. Number 7, if stock is received on the 30th of March 2024 with an expiration date of the 30th of December 2024, and there is already stock on the shelf with an expiration date of the 30th of Jan 2025, using FEFO, how should the stock be packed on the shelf? Okay, so this one takes a little bit of analysis. What is going on in this question? This is definitely a higher order question. So it says that you've received the stock on the 30th of March and it's expiring on the 30th of December. Okay, so at this stage, you are given the years because it goes over into January of the following year. But so you received it in March, it's expiring in December. That's your new stock that's just come in. But when you go to the shelf to pack your new stock onto the shelf, you see that there is already stock on the shelf, but that stock has got a date of the 30th of January 2025. So it's got a later expiry date. Then it says, now you must use FEFO. So now you have to know, what does FEFO? What is FEFO? Well, it's first expiry, first out. That's the principle that you're told to use in the question. And then you need to understand, what does first expiry, first out mean? It means that the one with the earlier expiry date must go in the front of the shelf, and the one with a later expiry date must go at the back of the shelf. And so they've labeled in the question that the stock coming in on the stock expiring on the 30th of December was the new stock that you were getting in. And then you had current stock, which had a later expiry date. So even though your stock that has just come in is newer to you in the pharmacy, it has a earlier expiry date and needs to be sold first. And so if you look at the options, that current stock that has got the 30th of Jan date needs to be packed behind the new stock because it has a later expiry date. So the new stock is going to expire first. It must be in front. And the stock that was already on your shelf is going to expire later. So it must go behind the stock that you've just received. Okay, and so this question is definitely a higher order thinking question. You've got to look at the information. You've got to try and analyze it and then apply it, look at the detractors, the answers, and see which one fits the best. So I'm going to leave that on the screen a little bit longer, just for you to look at again if you got it wrong. Okay, I'm moving on to number 8. Which of the following statements would apply to a tablet that is packed in an amber bottle? Okay, so now you've got a tablet. You've been told you're working with a tablet, and you've been told it's packed in an amber bottle. You should be aware of what containers are used in pharmacy. And we've specified that it's an amber bottle as opposed to a clear bottle. Another type of question that could be asked is, why is a glass bottle used instead of a plastic bottle? So the different types of packaging and why we use different types of packaging. And so if it's an amber bottle, that should speak to you about light sensitivity. Why is something being put into a darker bottle? It's to protect the tablet from being degraded if it's exposed to light. And so if we look at the options, the third option, the tablet is light sensitive, is the most correct answer there. And that is why it is in a darker bottle. That's what amber means. It's those brownish color bottles. Okay, here's an example of the computer program exit level, the competency in the exit level outcome 4, which spoke about computer programming or computer programs and using computers. Which computer program is most suitable for report writing? This is also an applied question, not a high LOC 3 question, but maybe a middle question, a LOC 2 question, because it lists computer programs, but it's specifically asking you to choose the correct one for report writing. So yes, I can write in PowerPoint, but am I going to submit a PowerPoint presentation as a written report? I might present my report in a PowerPoint to a group of people, but I'm not going to submit a written report in PowerPoint. And then in Excel, you're not going to use Excel to write a report. You might have an addendum in your report that has some figures and numbers and calculations where you've printed out a spreadsheet, but that's not going to be your actual report. Teams, well, you're sitting on a Teams meeting now. Again, you might be presenting a report through a Teams meeting, but you're not writing a report. And then finally, a Word document, which is your word processor document, is the most correct answer. Remember, we said single best answer. So you could argue with me and say, yes, but I can write a report in PowerPoint. But is it the best program to use to write a report? No, it's not. Okay, and then what reference source can be consulted if a pharmacist assistant basic is unsure of what the specified cleaning product is to use when cleaning equipment in a community pharmacy? So the question is really asking which document or which report, which policy, etc., has got the detailed information about exactly which cleaning product you should be using. Okay, and so some of you have said good pharmacy practice. Now, good pharmacy practice doesn't specify the product. Yes, it tells you that something needs to be cleaned, your equipment needs to be cleaned, but it doesn't tell you exactly which cleaning product to use. The only place you're going to find that is in your standard operating procedure of the examples that you've been given. Can you see that a pharmacology textbook is a bad, what we refer to as a bad distractor, because nobody's selected it. But wherever there's someone that has selected it, then it is what we call a good distractor. Okay, so we want the most correct answer, and in this case, the standard operating procedure is going to be the most detailed document to give you the exact cleaning product you need to use. Okay, and that brings me to the end of the general questions. So I'm going to hand over again to Mr. Arthur.
Thank you, Dr. Fogarty. Yeah, I'm actually done with my section. I think, okay. Sorry about that. Okay, so just a few more tips for preparations. So we're just reiterating what has been explained, even as Dr. Fogarty was going through the practice questions, and also what I explained even in the previous slides. So please make sure that you're using the latest reference material, and please check and be familiar with the current events. So like the previous years when we had the COVID pandemic, so you most likely also be questioned regarding the COVID-19 pandemic. Also keep abreast with the latest developments or information. I think I also highlighted where you can find your latest changes to regulations, especially relating to scope of practice. It's very important that you understand what you can ethically and professionally do based on your scope of practice. Familiarize yourself with each reference material, learn from your work environment, so that applies to your standard operating procedures. Okay, also refer to your course notes and check if the information is valid. So check whether the information is relevant, and never use a reference that you have not used before. So in an exam, it's not recommended. It's unwise for you to use a reference that you haven't used outside of the exam. Remember, if it's a reference that you have used before, you are able to access the information much quicker. It will prevent you from panicking. Okay, and always ask for assistance from your colleagues and supervisors. All right. Okay, so again, just to reiterate, it's important for you to know the date and time of the exam. So the when, and then the venue. If you don't have a quiet place for you to write the exam, I think the Pharmacy Council can help with that. Also make sure that you have all the resources that you need for the exam. And in terms of preparation, how can I prepare? Try to understand which references you need and how you use the references. And lastly, what do I need to bring to the exam? Okay, that's your reference material. And also what is going to be explained further by Metiniko is how the online exam works, the whole proctoring process, and the length of the exam. Thank you.
I'm just going to be very quick. I think I only have 10 minutes and I don't know how many slides are those ones. I'm going to try and summarize everything, because most of the questions that we were asking were relevant to the slides that I have there. It's many slides, but it's a summary of everything
that was already said. So those people who are learner basics, who are registered for the new qualification currently, they are the ones who are eligible if they have successfully completed the knowledge, practical, and work experience, as it was already highlighted, those modules. Then your provider is going to issue you with a statement of results. As soon as they issue you with the statement of results, and you on the 4th write the EISA practice exam, then you qualify to write the EISA. If all those three are not satisfied, you will not be able to write the EISA. If you haven't written the practice exam, or you have not yet received the statement of results that shows you are competent, you will not be able to write, even if you have finished the 6 months. The second category that we spoke about already, it has been highlighted. It is the learner post-basics. It's the pharmacist assistant basics who intend to enroll for the learner post-basic for the new qualification. As we know that the old qualification, it's phased out. The only people that are able to complete that old qualifications are the ones who are enrolled. If you are not enrolled and you want to do pharmacist assistant post-basic, then you have to do the EISA. It's your ticket to cross over. So now you must be registered, meaning with Pharmacy Council, it must be you have received a certificate for qualified basic. Then you have also written the practice exam, then you will be eligible to write that exam. The last category the last category will be the people who are former BPharm students who have done their first year of study in a university and have passed first year. That is the last category that will be able to write this exam. They will register with us as learner basic former BPharm students. Then when they are registered, they have to first complete 400 hours with an approved pharmacy under supervision. When they have done that, they submit the progress report and then write the practice EISA as well. Then they will be able to book. Then when you have logged into the website, Pharmacy Council website, like most of you have been playing around, I've seen the bookings are high. You go to the registered person. When you've clicked on registered person, you will be able to see the learner student trainee tab. When you have clicked on that tab and you have logged into you go on to log in, not the top login, which is red, the bottom one. You will be able to see this screen. This is where you will land, and you will book your EISA where you see the red circle. That's where the exam booking happens. As soon as you have clicked on that, it will take you to the examination booking, examination results. You ignore the other tabs because you will be booking for an exam, whether it's the practice or the main exam, it's the same process. You will go to examination bookings. You click on that tab. As soon as you have clicked on your tab, it will land you in this page. The examination fees, they've already highlighted that it's 711 for this year. If you have, then you are going to, if you are eligible, this screen will appear for you. And then you will have to select the venue that you prefer, whether it's home, Pharmacy Council offices. Please note that if you're coming to the office, we will be able to provide you with a laptop, with internet, and all the required things for you to be able to write the exam. But if you're at home, everything is on you to ensure that whatever is required is available. As soon as you have selected the place to write the exam, if it's work, you will say work for calculation and also for general section. Don't just select on one because you will not be able to book. Then you click on the red button where it says book examination. That is the next thing that you need to do. as soon as you are done with the practice exam, this page you will not go through because practice exams are free. But with the main exam, this is what is going to pop up. You will have to either have credit on your account. I will advise most of you right now, if you've got money, pay your 7-Eleven right now to your account, use your PIN number as a reference, because if you don't put reference, it's difficult. You'll need to send us a lot, and you can it takes a while for the money to clear. Few days, banks to banks, we don't know which bank you're using against the one we are using this side. So please try to start paying now so that you don't experience problems. But otherwise, there are other methods that you can also use. If you want to use the Visa card method, you click on the method that you will be preferring. So after doing that, the money will be deducted from your account. As soon as it is successful, that step, you will see this page, which shows that you're on a process of booking. So your case will be pending, as you see that red part saying pending when you have booked. So it will not have created a case yet, because the money that you have deposited must first be reflect on our side so that they can allocate it to you. As soon as it is allocated, a case will be registered against you. If you have reached this step and you don't have sufficient money, an SMS will be sent to you. We've already spoken about these dates that bookings have already started for the practice exam. We are closing on the 30th. So with the EISA practice, there's no grace time for late booking because it's on the 4th. The main exam is the one where we are strict because it is regulated to say how many weeks must we have before you can book for an exam. So you will book from the 5th of February. You can note that it's from a day after you have written the EISA practice. So day after, start booking for your exams. Then it will close on the 25th of February. So that is the period that we are opening up for you. If you are not booked within that period, you must know from the 26th of February, it's late booking. We are going to, the charges will be 1,066.50 that you will need to pay in relation to the 7-Eleven that you would have paid if you did your things on time. And then that booking will close on the 11th of March. That is our late booking. From 11th of March, no one can book anymore. Please, if you're experiencing any problem, as soon as you see the problem, take a screenshot, send it to us, to the PSP email address, call customer care, wherever you can contact as soon as possible with the screenshot so that we know what challenge are you faced with. So where do you, just a minute. So where do you see the EISA menu for the exam? Where do you access the EISA? You, under registered person, like we've already highlighted, you are going to you will not do as you are when you are looking for the practice. Instead of you logging in first, you will go under assessment. You see the red tab there, overview and all those under learner. You will go under assessment. Then you will be able to see that there are practice papers, the manual and other things. So for you, sorry, this is still for booking of the exam. I'm sorry for mixing up that. You are going to choose the places that are preferable for you, either work, SAPC or other venues. And if you decide to change the venue in between, feel free, please let us know. Write us an email. We will not take a telephonical request because we need to have records of that. when you are writing the exam, look for a suitable place to write your exam, where you'll be far from distractions, where there's enough space for your reference books and everything. The secret to these exams, there's a lot of things that can happen, but I'm not saying anything will happen, but it can happen. Stay calm. If you see something that is not making sense to you, communicate with your invigilators. So each one of you will be allocated an invigilator. An invigilator will have a few of you that they are looking at. So since this examination is online, your invigilator will be seeing you, and there's a chat box that you will be able to, on the screen, on the proctor system that we're using, which you will be able to send a message and a text. If not possible, we also have a WhatsApp that you can use to send us if you're having a challenge. I will not repeat about the reference material because they've already spoken to that and what you need to bring, your calculators and your working thing. So you've already asked the question as to what devices. Please, you need to have a laptop or a desktop. That is the first device that you need to have. You cannot use two phones. You need basically two devices for you to write the exam. So laptop or desktop is one of them. Then you can have either the tablet or your phone as the alternative. So please make sure that you have your phone and your laptop or desktop. So for you to be able to access this examination, at least have a bit of data, 3 gig minimum. As soon as you are logged in, the data will be taken from us to provide for you as for the exam, but at least the minimum needs to be there for you to have that connection to start up the whole process. And try to, if you have Wi-Fi, also have maybe alternative, maybe your phone, your modem or something else as an alternative Wi-Fi connection. Because if you don't have Wi-Fi connection, you will not be able to write this exam. The other thing is that your device, your laptops and your cell phones need to have a camera that will be able to record, because everything that will be happening from beginning till the end is being recorded, because there are violations that we will be looking out, like to avoid cheatings and all these things. So make sure that it has got a camera that is working and it is able to capture that. There are 3 browsers that we recommend, which we know we have tested are working with the program that is used, the Proctor program, which is used to write the exam. Mainly it's Google Chrome, Firefox, and Microsoft Edge. Please, as soon as you leave here, this is something that you need to do. If you are writing at home or any other place besides the office, ensure that these 3 browsers, you have them. Try to download all, so that when you are writing exam and you experience problems with one of the browsers, you can quickly switch to the next browser. We will also require you to update your profile picture on the website. You will need to take a color image which is recent of your recent self, and please let it be your face up to the shoulder, and it must be in color. So for you to be able to upload that picture, you go there where you see the picture there, you choose from your device the picture that you prefer, then you upload, you choose the one that you like and you upload there, it will appear. So, and also ensure that your cell phone number and your email address are recent. There are some people that we could not even send communication to because they don't have emails, they don't have cell phone numbers on the website. So please ensure that those things are correct. You're receiving communication from those things, because it's important. Where do you find the examination? Under registered persons, you go to the learner student trainee tab. You've seen that always. I'm referring you to the same first 2 steps. So after going there, this will be different from when you are logging into book for exam. when you're on this page for the exam, you're going to go on the tab next to fees and search, which says login. But when it comes to accessing the exam, you go to the tab that says assessment, the one highlighted in red. As soon as you are on that tab, you will see the bottom red screen on the screen. It will say external integrated summative assessment, which is the EISA. You click there where it says click. It will be listed. The practice exam will be the 4th of February. On the 4th of February, you'll find that exam there listed. Then you click. It will be able to take you into the exam venue. So we advise that you start logging in. If you're coming to the office by 8 o'clock, you should be here at Pharmacy Council offices so that you'll be seated and everything can be prepared. Even those who are writing from other venues, so that you can not take your time for the exam. The logging in process it takes a few steps and you might not be familiar with. So you need to start logging in. If there's challenges, please let us know as soon as possible so that we can assist you. The examination, as it is highlighted, will start at 9 and end at 12. So at 9 o'clock, the chief invigilator will start the exam. So you will be able to see your paper as soon as you are logged in. So this logging in process, even before the exam is open, you will be able to go through the process on the date. So I will not go in details because there will be a mini demonstration. The first thing is to log in like it's showing there. It will send you an OTP on the number that I said you must update. You remember I said on the system, you need to update your cell phone numbers. On your cell phone number and your email address, you'll receive an OTP number. Usually, I think it's 6 numbers or so. So those 6 numbers, you will put them there where you see a 0. And then you put the numbers that you will have received and press continue. As soon as you press continue, it will take you to the Proctor Education logins. And then there are declarations which will be demonstrated to you, few declarations that you need to make. Read each and every declaration before you tick. And if you haven't ticked on any of them, you will not be able to go to the next step. After that, it will take you to to start the exam. Before you can start the exam, it will show you this page that's written under 5, where it will tell you how long the the paper is, the total marks and everything. From there, it will, as soon as the exam is started, you will see the number 6 screen where the question is displayed. So each page display one question at a time with 4 options. If you can see, it is highlighted there, number C, as the option that the person has selected. It will not be having that blue before you select. As soon as you select, if you select B, that blue will go on the on option B. So from there, you will be able to either say next, or if you're not yet satisfied, you don't have to choose the question. You might need to come back to the question. So at the end of the examination, you will need to also do an examination completion survey. There are 2 things that you are going to declare about the exam, whether you were not cheating and you wrote it yourself and all those things. You read those declarations, it will be demonstrated when we are logged onto the proctor. Then at the end, it will take you to the post-examination survey. As soon as the exam is submitted, it will take you to the survey. That survey, please, we beg you to, if you have anything, it helps us improve the systems. Please input what you think about the exam or anything that would have been asked on the thing. So on the website, I've already highlighted there's a link that you can use as well to log in with, or use the method that I've told you about. It will be communicated to you, the link, or you will go to the assessment to use that. Then you will have logged in to do the exam. Those are the steps that we were talking about in details here. This will be demonstrated when you reach step number 4. It's going to check the equipments that are there on your laptop. So this step is very important. That's why I said when you're writing the exam, ensure that you have a camera. There is a microphone as well on your laptop. And also there must be network. Check that there is network which is connected. So it's going to check all those things that are listed there before it can move you to the next stage. If there's anything that is not there on your laptop, you will not be able to move to the next step. Then you can see on the side, there's a link which you can use to test your device if it is compatible for the exam, for this exam writing. So please try to go and practice with this link that is there highlighted. Use the link to see your compatibility. Then it will all turn green when it has checked. Then you press the next button. As soon as it is happy that all these things are there and are fine, the next button will become green. Then you will press that, then you like it's indicated on this one, and then it will give you your name. You will have entered the exam platform. It will show your name that is there. If it's not there, please update your name and your last name and your first name. If you don't have middle name, it's not a problem. Then press next. Usually, and then from there, it will take you to this screen where you will verify your picture. You will try to be as close as possible, like as it is indicated on the picture there, so that it can capture the face. There must not be too much light. I mean, there must not be too dark, the room that you are in. There must be enough light. So close the curtains behind you, close everything behind so that the lighting in the room is sufficient when the light it's shining on you. So if you struggle a bit, try to move to another room where you can quickly take this picture, because sometimes it can be a challenge if you don't have enough lighting. As soon as this is the laptop, I mean, the program is satisfied with this, it will give you the QR code that is there. You need to scan with your phone. Remember, I said you need to have 2 gadgets. The second gadget, which is your phone or your tablet, you will scan this QR code, and then it will move you to that play video. You quickly go through that, and then it will take you to the declarations as it's already highlighted earlier. These are the declarations that you need to make. You need to know, I mean, it will be highlighted to you when we're doing a demo. You need to read the instructions for the exams. So it will take you to this page at 9 o'clock. Read all the instructions so that you know what you're not allowed to do and what you are allowed to do. As soon as you are done, then that is the exam. So it's basically a repetition of what I've shown you earlier. Then, if you are writing this exam not in South Africa, which can happen, some of you are in another country. Remember, the time zones are not the same. You will need to adjust your time on your laptops such that it is suitable for this, because if not, you will not be able to write the exam. It will not give you access. Sometimes if you are not connected to the Proctor system, you will see this message. Then you need to check your connectivity and all that, and ensure that you close your browsers and go and reopen on another browser maybe, and then log in again and ensure that you are able to log in. So as soon as you have finished logging in and did the declaration, before the exam starts, if you are done, again, we started at 8 o'clock till 9 o'clock. Before the exam is open, if you can press start exam, the the tab on your right is the one that on your left is the one that is going to appear. It will tell you that the examination is not yet started. But as soon as it's opened and you press start examination, you will see examination started. And then you click OK, thank you. Then you can continue writing the exam until you finish and do the declaration. Examination format, it was highlighted. Let me not take too much time on this one. It's one question per page, and then the questions are randomized, but you will be able to see that this is question 1 for you, but the next person, which must not be next in the same room with you, will not have the same question as the first question with you, but all the questions that are there, the 100 questions, you will go through them before you finish your exam. The exam is timed, so the 3 hours and a half that we said it is, when it is done, your examination will close, even when you are not done. But be rest assured, whatever you have answered, if you've only answered 8 questions of the 100, all those 80 questions will be sent to us so that we will be able to mark those questions. The system can mark those questions. So if you had skipped one of the questions because maybe you didn't know the answer, you can always, it will come back at the end, that question that was skipped. So as this, I've already explained to you how the questions are going to pop up. On top, it will be the questions. At the bottom, it's the options. You choose the best option that suits you best. They've already told us, our experts, I won't repeat that. There are violations that the system picks. If you are in a room and you're busy talking with other people, it will pick that you are not alone, you are not writing alone, you are probably getting someone to help you answer the questions. So noise will be picked from whatever, but sometimes it can be things like beds and other things. The invigilator, when they see that background, if it's an innocent thing, it might be something that maybe can be overlooked. But if you are getting answers or whatever, they can hear every conversation that is happening there. If you switch to another window different to this one, you want to cheat and get answers because you said you mustn't Google answers, it will also it will alert us. It will be a violation. All these violations you will be able to also see. So if you're not connected to your mobile cameras or anything, it does indicate when you have challenges. The quick thing to do, if it's related to moving to the next step, quickly close your browsers, open the other one. If you're on Edge, go to the next browse out of the 3 that we have said, so that quickly you can get back to the exam. Unless it's continuous, do the screenshot, quickly send it to us. You can chat to us at any given time, before and during, at any given time. There is a chat box on the proctor when you're writing exam, where you must send your queries or your questions to the invigilators, not the questions about the question that is being asked. Yeah, so you can send that and also send to the invigilator. They will take some time to respond because obviously they might not have you alone, or they might need to verify some few things, facts before that. Keep your cell phone close to you. If there's information that we need to communicate to all of you about the exam, we will send to the number that I said you must update. You can, the invigilator, when they see that there's some violation, maybe they can't see you on the second screen or anything, they will call you and try to tell you to connect your other gadget or to say whatever violations there is. So please answer and stay calm at all times, no matter what, how frustration the situation. In most areas, load shedding is no longer there, but please, if in your area you do experience load shedding, check the schedule. If it is not going to be possible, move to an area where there is electricity, and ensure that your laptop is fully charged before you start the exam. And the Wi-Fi is there and the alternative that you need to have. So it is very important to have all these things. And if it happens that you do have unforeseen load shedding, please email us immediately and let us know if you're changing a venue or there is anything that we need to know about. So we've already explained that. So when you are trying to log in, sometimes it might kick you out, and then when you come back, it just shows you that here at the bottom where you see the cross, the black cross there, it will show you that the invigilator is no longer seeing your face. So for us to see your face from your phone, you need to click on that cross. It will pop up this four tabs where there's a QR code and a calculator. If you need to use a calculator, you can also use that one. The QR code, you scan it again so that your phone can reconnect to the device, because at all times we need both cameras to be seeing you, the one on your phone and the one on your laptops. We're seeing from the front and also from the side. So it is very, very important to do that. Do the communication via email at all times. Close all browsers to log in again. Close them. When you see that it's not working, close everything, restart again, log in again, it will connect you. Some of the steps when you are reconnecting will not, may not be the same as when you're initially logging in. So I told you that you need to be in a place where there's enough light. Another point that we need to emphasize, please dress properly. We are saying everything that is happening. So we are seeing through the cameras. We see everything. You will not want us to have a record of you half naked or an inappropriate. That is going to stay with us permanently. So ensure that you are covered. You are in a way that you will want to see yourself in 10 years' time, because those records will be there for a long time. So when we're done with the exams, you have submitted and everything. When is the main exam, they've explained that a practice exam within 2 days or so, you will have seen your results. This is the tab where you go, where it says examination results. The same way you log in when you want to book. Instead of going to examination, this time you go to that tab which says examination results. Then you click on that one. So you will be able to see your results if they are out there. And also a message will be sent to you to explain, to tell you when the examination results are out. You are allowed to apply for a remark, but under general, you need to know that the results are checked and verified. And this is electronic. So your answer that you select, as you are selecting, the computer is already marking to say you have chosen the right, correct answer. So for you to verify, it's just for you to understand maybe where you went wrong. So you can come for remarking so that you can verify where your challenges were. But there is a fee that is payable for you to be able to check that if you are not satisfied with what has happened. So I think I will give, no. I'm not sure if Molalo will love to demonstrate, or I can go quickly to demonstrate for you how the exam is.
Yeah, I'm demonstrating how you log onto the system. I've already gone onto the website. So I will proceed and put in my OTP. Which has come through on both my registered cell phone number with Council, as well as my registered email address with Council. Okay. So the landing page will be the proctor. That is the gateway to accessing the examinations. There is no other way. Even if you come to the office of the registrar, it is the only way. So the system will conduct system verification checks. And if there are pop-ups that keep showing, you need to allow them. Because if you don't allow them, there is no problem with the system. There is a problem with your settings of your computer. So that is why it's important for you to practice at your own free will before the practice exam day, right? To avoid further delays. So the system will do as it's doing now. I'm sure you are all able to see that it's conducting its own web check. So over here, it says allow while visiting the site. I'm going to say allow this time. And for SAPC purposes, I would allow all the time because I do know who that SAPC is. And you see now, when I said allow this time, it was the webcam. Please mute your mics. Please mute your mics. I can't hear myself. So the webcam then ticked okay. So I'm going to continue to say the microphone must also be allowed. Are you still hearing me? Because I'm also using the microphone to speak to you.
Yes, we can. Yes, we can.
Right. And then now I'm just going to do what is correct because I have to share a screen and you can see that the invigilator would know that I have two screens open, which is a violation. I only need to have one at a time. I'm going to have to disconnect it. Going back to the microphone check, it is going green. That is, I'm compliant with the requirements of Proctor. And the screen is not compliant because I have two open. I'm going to have to comply and disconnect one, which is why you're seeing some dark lighting now. I'll have to reconnect again to share my screen. I should be sharing my screen now, and it takes me back to the Proctor pages, and I have to retry. There is no shortcut. So I have to click on that screen that I am needing to share, which is the entire screen. And then I have to say, please share. At this point, the invigilator cannot see you. You are at your respective writing venue, and you need to get to pass this step in order for you to land on the pages where your invigilator will be able to see that you are logged in. It continued to do the background verifications, interacting with me so that I read for meaning and action what the system is requiring of me, right? I'm going to click next because all the system checks are done. There is no need for anyone to complete their name. If your name is incorrect here, that is going to raise alarm bells because you registered in using your PIN number, your ID number, and your own login detail, which are secured credentials, which aren't shared with anyone else. So the system needs to agree that the person who has logged in is Moraro Pungo. And we are now at step 3 of 5. So we click next. And this part here, I'm going to need to take a picture of myself. This you need to also practice. It's similar to the banking apps. If the facial recognition doesn't pass, there is no problem with the system. You just need to do it until you are successful. So I'm sitting in a very dark area, and I'm also an African dark girl. So the lighting needs to be a bit more brighter. I'm going to try and get some lighting from my phone. Please just bear with me. Just to assist the process. I'm almost there. I'm gonna need to remove my headphones. You may not be able to hear me clearly now because when you do facial recognition, you may not have anything obscuring your face. Okay, it is the verification step. Just a second. Okay, right. So with my patience and my allowance of time, meaning I log in on time so that I can play around and do the necessary skills until my picture is taken. It is happy with the picture. I'm going then to click next. The next step now takes me to my cell phone, which is the second device that Lisbeth spoke about. And at this step, it's a QR code that's being displayed, and you'll stop me if I'm now going ahead of the participants. So I need to then take my phone, similar to what you did with those Microsoft question forms. You need to scan the QR code with your phone. So do make sure that your second device, your tablet or your phone, cell phone, mobile, is able to do this function, and then it will announce itself on my cell phone so that I know who is the host. It's the test SAPC in this case, and I need to allow the microphone and camera on my phone, and it's interacting with me, like I said, and we read for meaning and then we action, right? So I am waiting because I've now allowed the scanning to happen. And it has just told me that I didn't allow the camera, and it's going to ask me to continue doing that. And that's because I must tell you guys that when you give yourself allowance, you're going to save your lives. Because I am also logged onto my phone on this workshop. So I'm going to have to disconnect that, right? And leave the meeting from my phone. I'm leaving because otherwise then that is the problem. It is not an SAPC related issue. I have to find a way to leave without ending the meeting. Just doing that now on the side. Okay, I have left the meeting and now my phone continues to interact with me. And then I'm required to record my surroundings, and in order for the system to record all of this and feed itself in terms of whether I am complying with the requirements, it needs to be a quiet place. I need to be complying with all the rules of the examination. So as I speak to you now, which I'm gonna try and ask that I turn around the, I need to turn my video on, rather, on your computers. Like I said, I'm a dark girl in a dark office. My phone right now is doing the recording of my exam environment, okay, as a requirement. It takes about a minute to do that, and then I need to be showing all the areas of my room. And once it's done, it's 10 seconds to go. It will notify me that I have now complied with the requirements of the video. As I said, I'm waiting for it. It's a bit blurry, but that's exactly what's happening on my side now. And it was not very happy with my recording. So I need to be patient because, like we said, if you don't do according to what is required, unfortunately, you need to do it until you're successful, which speaks to the amount of time that you need to graciously give yourself for a successful login before the start of the exam. Okay, and I'm doing also something wrong. I didn't charge my phone fully. Dinico touched on that. So we're going to be cautious there, right? I'm just waiting for my video to load. I'm still waiting. Just a few seconds to go. Please stay with me. Let me show my workspace area. Let me show that I am alone. Even if I work with other people, everyone is sitting at their station. I'm now saving and it's now successful. Like I said, it's blurry, but it asks me if we can save the video, yes or no. If you're not happy with the video, then you say no. So I'm going to say yes because I'd like to save it. And it will be a successful journey back to the computer soon. And I will then show you. You see, for my side now, I'm gonna need to stop this Teams video so that I can go back to sharing the pages where I'm logged on. that I said when the phone is successfully now logged in, because it's a required gadget for logging into Proctor to access the exam. So it's a communication between my phone, my laptop, or my tablet and my desktop, right? And then there where I scan the QR code, it now says to me, go next. It's prompting me. Then it allows me into the event of the day, which is your EISA, the Integrated Summative Assessment for the basic. And then you're able to start from your side. If it keeps saying to you, share the screen, please oblige, do share the entire screen, because it keeps checking if you still have one screen open, okay? And then that is the famous declaration that Doniko spoke about, which mine is ticked, but yours will not be ticked, and you've got to read because it's a commitment to this exam journey that you're writing. And you keep hiding this because it's not necessary. And over there, you can see there's a circle. This, you see your face. The invigilator sees you through this picture as well. And if you're not complying, you are looking elsewhere, you are talking to your friends, it's going to report a violation. If you click on this one here, very important to remember, if it doesn't say live proctoring on, like those screenshots that Doniko spoke about, you then need to always make sure that you are connected, because we then remove you from the exam because you're not compliant, whatever the explanation is, unfortunately. So you then get kicked out. But you can see this circle here, which is your picture. You click on it. It's got all these tabs. The tab of interest here to log into back on Proctor is this one here, which then gives you that QR code, which you scan in the same way until you come back in, right? Another thing is the calculator. Dr. Fogarty touched on it, that there is a calculator which you can use. There it is, right, to do the functions of the exam. And then over here, we've got a chat function. This chat function is for you to communicate with your invigilator once you are logged in. It's not available for anybody who's not logged in. You're able to communicate with your invigilator. Good day, may I go to the bathroom? No, good day. And then it goes through, and then the invigilator is able to see it on the other side, right? There is some, okay, that we have already touched on. There are some forbidden areas, ne? So this one here, you see, if I read completion of the session, means that if you click this, finish the session, you want it to end. Once completed, you will not be able to continue. We do discourage you to come here, because why would you want to end a session prematurely when you've not accessed the paper, when you've not written the paper? So that is what we're talking about in terms of logging in. And I would just like maybe to show you one thing quickly here. I think I need my senior manager to guide me because we're out of time if this is necessary, but we wanted you to just also see that when we say the invigilator is going to have a view, they will definitely have a view of you. I'll probably do that in 1 second. And while you are waiting for me, we would like for you to use the link that we posted to indicate that you attended the session today. It is important, it is required, okay? I'm just gonna be 1 second away, and then we will be good to start our Friday. Right, so on my screen on this side, I'm going to show myself here. You see, I have logged on as a learner, and I did say good day to the invigilator of Pharmacy Council, and they received the message. And they are able to click here. You see, I'm talking, I'm violating the room exam rules. I'm talking so the invigilator can see me, right? They can see different angles, but Moraro is not complying, because how is it that they only see one picture and she looks like she's sitting upside down? It's not fair on the examiner and on you, because they're going to start talking to you stop to say, please do this, do that, do this, do that, right? So the invigilator is required, okay, by the exam rules to see my workspace, that would be my computer, my work surroundings. So I need to position my phone, my second gadget, at an angle so that they can see. The other thing, because I've moved now, right? Let me rather maybe use something like this, which is a previous one, where I wanted to show you that, excuse me, if I'm writing the exam, they also need to see that I'm writing on a computer or a desktop, as we sometimes, refer to this different equipment. So at this point, they would have to see a screen here that shows my surroundings. They would need to also see another screen of myself like this, and then where I'm writing the exams. That is important for when I'm moving to different tabs where I'm not supposed to be going, where they're able to see, okay, she's on the website. Now she's asking the website a question. That's a violation. Okay, she's on the website. Now she's accessing memes online or whatever. That is not a violation, right? So I think for the sake of time, I'm going to end it on this note. Let me see if I use yes. So the interactions happen like this way. I'm speaking to you, I'm the madam from the office, and you are the candidate writing the exam, and we are interacting, we are helping you, we are guiding you so that it's a success. I would like to pause here because the rest of this, you have an idea. This is us in the office, but you are on the other side writing the exam as the intern. And I think I have left that screen somewhere. So I would like to please be allowed to pause and then maybe hand over to Kamo to just give us a word or two of gratitude. And then we end the session. Thank you.